Welcome to the Self-Administration Made Easy training video for Hizentra, a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Before we start the details of self-administration, please take the time to review the important safety information for Hizentra, available on hizentra.com. This video provides step-by-step instructions to help you remember how to infuse Hizentra. Ask your healthcare provider about any instructions you don't understand. Infuse Hizentra only after you have been trained by your healthcare provider. This video does not contain specifics about dosing or treatment schedule. Your doctor will help you develop a treatment plan that fits your needs. The patients we're featuring today in the self-administration video have something in common. They're living their life, their way, with Hizentra. Hizentra is a subcutaneous immunoglobulin therapy that you can infuse on your own, when and where you feel comfortable. Once you learn how to self-infuse Hizentra from a healthcare provider, you can work with your doctor to create a customized infusion routine. You and your doctor can decide what days and at what time you want to infuse. And to help you become confident self-infusing by yourself, you can get free visits by a trained nurse who will make sure you're comfortable infusing Hizentra. Patients like Melaine, L.L.C, and Daniel have learned to self-infuse Hizentra from a healthcare provider. Now, they have the confidence to infuse at home and have the freedom and flexibility to fit Hizentra into their life. You can follow these easy instructions each time you give yourself your dose of Hizentra. The following steps should be performed in order each time Hizentra is administered. Ask your doctor or healthcare provider about any instructions you don't understand. We'll show you the infusion process in 3 overall phases. It's easy. Get everything ready, set up the infusion, and go. Let's get everything ready. Step 1. Gather supplies. You will need Hizentra vials and other items such as the infusion pump, sharps container, and your treatment journal. Your treatment journal can be found in your welcome kit on hizentra.com, or you can use the My Hizentra Infusion Manager app. You'll also need to gather any other items you may choose to use that are provided by your doctor or the specialty pharmacy. Step 2. Clean your surface. Choose a flat surface and sanitize the surface with an alcohol wipe. Clean the entire surface thoroughly. Step 3. Thoroughly wash and dry your hands. If you have been told to wear gloves when preparing your infusion, put the gloves on. Now, let's get set for the infusion. Step 4. Check the vials. Before each administration, carefully look at the liquid in each vial. Hizentra is a pale yellow to light brown solution. Do not use the vial if the liquid looks cloudy, contains particles, has changed color, the protective cap is missing, or the expiration date on the label has passed. Step 5. Transfer Hizentra from the vial to the syringe. To do this, you will need to take the protective cap off the vial. Clean the vial stopper with an alcohol wipe and let the stopper dry. Your doctor will either recommend you use a needle to transfer your Hizentra from the vial to the syringe or use a transfer device. If using a transfer device, read the manufacturer's instructions carefully before following these steps. Unpack the sterile device and syringe. Remove the protective caps and attach the device to the syringe. Place the vial on a flat surface and insert the spike into the top. Flip the vial and syringe upside down and withdraw the desired volume of Hizentra. Remove the syringe and attach the device. If using a needle and a syringe to transfer Hizentra, attach a sterile transfer needle to a sterile syringe. Draw air into the syringe equal to the amount of Hizentra to be withdrawn. Insert the needle into the vial stopper and inject the air into the headspace of the vial. Withdraw the desired volume of Hizentra. Remove the syringe and attach the needle. Step 6. Prepare the pump and tubing. Be sure to prepare the pump following the manufacturer's instructions. To prime or fill the tubing, gently push on the syringe plunger to fill the tubing with Hizentra until fluid can be seen near the end of the tube, but not as far as the needle itself. Step 7. Prepare the infusion site. Hizentra is infused subcutaneously. This means that it is infused into the fatty layer located just under the skin. Select an area on your abdomen, thigh, upper arm, or the side of your upper leg or hip. Your healthcare provider can help you pick the exact location and number of infusion sites that are right for you. Use a different site from the last time you infused Hizentra. New sites should be at least 1 inch from a previous site. Never infuse Hizentra into tender, bruised, red, or hard skin, and avoid infusing into scars or stretch marks. Do not use more than 8 infusion sites at the same time. If you are using multiple sites simultaneously, make sure sites are at least 2 inches apart. Once you have chosen sites, clean the skin, allowing each site to dry before proceeding. Step 8. Insert the needle. With 2 fingers, pinch together an inch of skin around the injection site. Then, insert the needle under the skin. Use sterile gauze and tape or transparent dressing to hold the needle in place. Now, let's go to the infusion process. Step 9. Start the infusion. Insert or attach the syringe to the pump. Then, turn on the infusion pump by following the pump manufacturer's instructions. Step 10. Record your treatment. To record your Hizentra treatment, peel off the removable part of the label on the Hizentra vial and put it in your treatment journal with the date and time of the infusion. Also include the exact amount of Hizentra infused. Scan the vial if you are recording the infusion with the My Hizentra Infusion Manager app, or record using your treatment journal. Step 11. Complete the infusion and clean up. After all the Hizentra has been infused, turn the pump off. Gently remove the dressing from the skin and pull the needle straight out. Throw away any unused Hizentra and the used disposable supplies in the sharps container, as recommended by your healthcare professional. Clean and store the infusion pump. Your doctor may ask to see your treatment journal or infusion app, so be sure to take it with you each time you visit the doctor. With self-administration, people living with CIDP or PI can plan treatment around their lives instead of planning life around treatment. Hizentra dosing makes it easy. Get everything ready, set up the infusion, and go. If you have questions about Hizentra, call IGIQ, CSL Behring's single source for immunoglobulin solutions, at 1-877-355-IGIQ. You can learn more about Hizentra on our website, hizentra.com. Call your doctor for medical advice about side effects. You can also report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Thank you from CSL Behring, maker of Hizentra.